Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I wanted to say I don't have a lot of time left here, but we have covered orthodontics from before the people marry till after, till up to death. You could do any kind of orthodontics you want to do, and you can move the teeth as long as people live. And I think this is something that we needed to know, and this is what the university-trained orthodontists should be doing, and let orthodontics alone, and let general dentists and other do orthodontics, and don't look down your nose at what they're doing, and help them learn about it. So I came up with a way of correcting class 3 malocclusions. Instead of doing this double jaw surgery, you can actually correct probably 85 or 90% of these surgical cases can be done with orthodontics. And I've done about 8 or 9 of these cases over the years. And I've got one here I wanted to show, especially, is a favorite one of mine. She went to 2 or 3 surgical orthodontists, and they wanted to do surgery on her. And she heard that we were doing this without surgery. And so we started this case several years ago. In fact, I'm going to show some pictures of her that are 37, nearly 38 years ago. We did this type of stuff. And I didn't notice anybody coming after doing this during that time. Finally, we had somebody, one of the head teachers in our AOS, did a case, but he didn't use the upper lip bumper, and he didn't, in retracting the lower teeth, didn't bring them back. It's kind of lead them, like you can take somebody like that and move their teeth together. But that's the way we used to do it. You got to bring these teeth back, and then you got to bring these out forward. And so that's what we do on this particular case. I'm going to show this. Now you can go look it up and get on here. We've got several videos on her case. And here we'll start. Now this is her back in 1987, February of 87. That's the way she came in. And she had been to 2 or 3 surgeons, and they wanted to do surgery on this. Now, I've scrubbed in on surgery with them, and I know what they do. You take the whole upper arch loose, and then you section the jaw down here and bring it back in, and changing the condyle and the fossa relation back here is something they can't really do properly. Whereas you could do this slowly, the whole thing will grow into position better than you can put it there surgically. So let me go ahead and show this. Here is it after we had worked on it a little bit. But this is a class 3 malocclusion. And you can see these teeth are inside the lower teeth out here. On this side, they're not too bad, except back in the back part. And we've got these lower teeth protruding out like this. Now I'm going to breeze through this. We figured out a way to do this orthodontically. And what we did, we come in and we extract the lower 6-year molars. This allows us to move these 8 teeth. Let's see, There's 2 bias and a cuspid and 2 is. It's 10 teeth actually. And bring all this back in this direction. While we're doing that, we pull these forward till we get them to a class 1. In other words, it'll come in something like this. We're going to pull these teeth back to something like that. And we take these teeth and back them up. Now when we get through, you look at pagodias. It's where the chin goes out, and we slid these teeth back, but kept them at this angle. And we brought these teeth forward, and we kept them at a good angle too. Other side the same way. And we took a large arch wire and expanded this, went out this way, and got it fit over the teeth properly. Now let me move on here pretty quick. We're going to have to turn this around, and that's hard to do without stripping the bones with the teeth, because these teeth they're this way here, and the root of them goes out that way. And they will strip very easily. So you have to watch that. Now we're going to take these teeth out, and we'll pull these back about here somewhere, and bring these up to this part. We pull these forward by pulling this back, and we also pull the upper teeth forward while we're pulling this back, and make that match up. And it works. And it's after 40, let's see, she was 25 years old when we started this in 1988. I don't know whether that's the exact date on that. But we're already into this case. We started in 87. And we take these 6-year molars out. It looks like a ridiculous thing. She had some periodontal problems, and she did not smoke, or I wouldn't have started. If she had smoked her, that wouldn't have done this. So here you're closing this space, and you watch it come together. And this periodontal problem, and it fills in pretty good. Okay, we're going to run through it pretty fast now. That's a little flexible wire. You could rotate any tooth in the mouth with that at any time during their life, by the way. And we had to open this up, and then we will turn that tooth around, and you'll feel it strip off some down there. And we'll close this up to class 1 to bring this back. Now, if you're going to take teeth out on adults or someone like this, have your brackets on the teeth ready to go. And you pull this out, and then you put something that'll stop them from bleeding, and start moving the tooth into that space that same day. If you don't pull those teeth and wait a month or two to start, because this bone structure right here will just move in like that. And you'll have a knife edge ridge in here to work with. And it takes a long time to bring the teeth together. So you ought to start working, closing the space the day you take the teeth out, or have whoever takes them out come over and you start pulling these teeth together that day. And you can get them together before this bone structure closes into a knife edge ridge. Now here we're expanding with a large arch wire, and we've shown you how to get buccal root torque as well as buccal crown torque. And you have to have a rectangular wire in here and have it where it's pushing on the tissue up above, and you're pulling it out down here to expand the mouth properly. Now we're coming together. Now I'm going to show this. Okay, here we are, 1988. I don't think that's the right date on that. But here she gains a little weight while we were straightening the teeth, but we have her back now. Hardly any class 3 showing right there. Now, as we came forward with these teeth, we have to run interference. In other words, you got the lip bumper out in front, leaving a space between the lip bumper and the tissue. So soft bed of tissue to carry the bone out there. You can't just push teeth out in a place like that. So this is essential to do that. And down on the bottom, we didn't have to do that because we were going backwards on this. Now we turn that tooth around, and we've got a little gap there, but that corrects itself pretty well before we start. Now these teeth come out. Now we finish the upper up where we got it, and we're bringing the lower teeth back and keeping them at a good angle. And that was 91. Here, we started in 87 doing this. We took longer than I thought on doing that. Now we widen this out, you see, and over here, and so you can see this fitting. The midline is lined up good. This is that tooth that was turned sideways down here, and it stripped a little. And the appearance of this is like this in 1991. Now she wasn't scaling the teeth good. She had some calculus in there that needs to be scraped off. But we wore a brace, and this kept this arch wire at this height. See that little deal right there on the tooth. Now, we go from 91, and we found out where she was, and a lady, a friend of ours, knew them, and I know where she is now. She was an assistant, worked for Southwest Airlines most of all of her life there. And we expanded that with an 040 arch wire, plus the rectangular wire put the pressure on the roots above too. So here she is, several years later. And then I'm on shore 37 years. This is the way it went. And this is back about 10 or 12 years, I think, after we did it. Now, this is an important x-ray. These teeth, Pagonium, did not go back. And I thought we might have to come and do a genoplasty here, but you couldn't tell it at all. So we never did have to go do that. And so these teeth are back right here. And this Pagonium is still out in that area. I'm going to move that back and let you see where it is. Now that is out 010, I think. Now we left the wisdom teeth up here. We took these teeth underneath there and brought them up to there. Now if this doesn't bother them, you just leave it there, or you can put a retainer that'll hold it up, but you won't be using that part of the tooth. But that's after we finish this, January. Now let me see how many days. Now here we are at 7010 from that to that. That slipped a little bit. Actually, this tooth ought to be further out here. So we had some relapse on the case, not much. That's 87, and that's 2010. Now that's 87 to 12. No, 87 would be 13 years plus 25. And there's the thing when we started. Here it is when we finished. This did not go back with that. The Pagonium stayed out. So here she was. We started 87, and there it is later. Then I found her, and this is a picture of her just recently. And that's 37 years after the case was finished. And that's the way the teeth look today. And I know where she is. And that's the end. Now, this should shake up surgery. And this is what most of these people would be happy to pay if you could just see a double jaw surgery where the maxilla is cut completely loose and shortening the jaw down here, and now we let it grow slowly, and the head of the condyle and the fossa match up better than it does if you surgery just move it over there immediately. It matches up. And you don't know exactly where it to go. But while you're doing it slowly, the whole thing changes. And this is 37 years later. Here's the same young lady right here. And so this is going to shake up surgery, and we can do about 85 to 90% of the surgical cases could be done orthodontically. And that's one of the best things I could offer to people. And I won't be around there. I've lectured on this for years, and there's hardly anybody has got guts enough to try it, to use it. But anyway, it works. And I thank you for watching, and I'm going to hang up now, and you can come back and go over this completely and see what we did. And I will say goodbye for today, and I'll holler at you later. Thank you now. Bye-bye.